So you lost a tooth in your 20s and now it's 25, 30 years later in your 40s, you've got the time and the money and you really want to replace it. Is that an option?
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
Yes, absolutely. Implants are a great solution. Ideally, it's better to replace the missing tooth closer to the date when you actually lost the tooth. And the main reason for that is because the body is very efficient. When you have teeth, they maintain the bone. And when you lose teeth, the body realizes, hey, I don't need to keep that same amount of bone there. I'm gonna start shrinking down and resorbing away. And a lot of times, if it's just one tooth that you're missing, the adjacent teeth are gonna maintain some bone in that area. But unfortunately, over time, and the longer you wait, there's a pretty good chance that your body's resorbed that bone and kind of taken away the ideal site for an implant. What we do when we plan for an implant, whether you've just lost the tooth or you've been missing it for years, is we do a three-dimensional cone beam image. And what that does is it gives us the ability to look at that space where we want to place the implant and evaluate not only if we've got the right amount of bone, but the right quality of bone, the right thickness of bone. Because for an implant to be successful, it has to be fully surrounded by a good perimeter of healthy bone. So in a situation where you've lost a tooth for a long time, even if you've had the bone resorb and it doesn't seem like it's a great spot, we've got abilities now where we can actually grow the bone in that area through bone grafting procedures. Sometimes that's necessary, sometimes it's not. Sometimes if it's an upper tooth, the sinus will drop down in that area and we have to do what's called a sinus lift. And again, all this is very common procedures, but basically what we're doing is reestablishing the right amount of bone so we can place an implant. So if you've lost that tooth 20 years ago, definitely don't give up hope that you've missed your opportunity. Sure, it's definitely easier closer to when you lose the tooth, but we have ways to build that bone and allow you to get the implant down the road. And for those of you that are unfamiliar with what a sinus lift is, it really has nothing to do with your nose sinus in this area. It's more towards the back area. You have these little tiny sacs of air that kind of scallop around the roots of the teeth. And a lot of times when you lose a tooth, that bone will drop down, that air sac will drop down. And so what we have to do in order to make room for the implant to go in that area is kind of push that sinus out of the way and put some bone in there so we've got great thickness for a successful implant. If you happen to be in a situation where you've lost the tooth and your body has remodeled so much bone that for whatever reason a bone graft or bone growing procedure isn't possible, we still have many other ways to replace that missing tooth. So don't give up hope. We could do a bridge where we put a crown on either side of those teeth with the tooth in the middle, it's cemented in place, and it looks and feels just like you've got all the teeth. And in the worst case scenario, if we can't do implants, we've always got the option to make you something removable. We specialize in making partials and dentures that replace all the teeth or some of the teeth. They give you a very lifelike look and feel. It's just unfortunately something you have to take out at night. So while it's true that it's never too late to replace missing teeth, if you lost in your 20s or 30s and now let's say you're 50 or 60 or even in your 80s, it's never too late to replace missing teeth, but just depending on the quality of bone and the areas, we have lots of different paths we can go down to get you back to functioning, looking, and feeling restored fully. So if you're in the situation where you're looking to have a front tooth replaced, a back tooth replaced, multiple teeth replaced, we can handle all that here in our office in Brookhaven. I'm Dr. Brett Langston, owner of Dental Implant and Aesthetic Specialist, and I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.